Are you guys able to see?
Good.
See okay, the screen?
Yes.
Okay.
Yes.
And I wanted to, let's see, let me figure out how to move this around. I'm having technical difficulties now. Oh, here it is. Okay. I think that's what I need to do. I have two screens. Let's see if that works. Oh.
And we had this working
Okay.
half an hour ago, didn't we?
Yes, we did. Can you see the agenda now?
No.
All we can see is the Lynn County Mental Health screen.
Oh, okay. That's my thought.
You want to be able to show two things at once?
No, I was trying to, let's see. Sorry about this. Try this again. See if I can get it to work. Okay.
There. Okay.
And so there you see an agenda now, right?
Yes.
Okay. So I was trying to get it up on my big screen so I could see it better. But when I start the screen, it pops it down to my laptop. So I'll be operating off of my laptop. So the agenda I have today is obviously an introduction. Kind of did that already. And then I was going to do a Lynn County mental health overview, just a really general overview of what Lynn County mental health is, who we are and what we do. And then get into kind of the Lynn County mental health pandemic response, looking at how we responded to the pandemic with mental health, and looking at the pros and cons. And I'm going to focus on some data too that I got on kids versus adults during this time. And then at the end, I'll talk about kind of tips and mental health issues around the pandemic, and then end on a slide that has resources, which I think are really important to have for people in general. And as a church organization, you could share that as well. The other thing I want to say too, is talking to Tim earlier, is that I like interactive because I can give you kind of my lens of mental health during the pandemic. But this is interactive. This is your time too. So if you have questions or want to discuss something, even throughout the presentation, don't hesitate to chime in and ask a question or a comment. Again, I want this to be interactive because it's your time as well as my presentation. Granted, we'll have more time at the end too. The downside to this is I can't see you really well. So if you do chime in, go ahead and speak up, or if somebody could monitor, if somebody's raising their hand or making comments, if people can monitor that, I'd appreciate it. Okay. Oh. So it sounds like Marydale already put out my bio.
Yes.
I told her I've never done a bio, to be honest. I've never done one. And so I started out with my professional, and then I was thinking, should I add something about myself in a personal manner, because I've never done one. So I did add a little bit, because I am more than just work. At least I try to be more than just work. So I probably know that I've worked at Lynn County Mental Health for a long time, 23 years now. Prior to that, I had about 4 years at Polk County Mental Health. And then between Polk County and Lynn County, I got my master's in social work. So I have about 27 years in the mental health field. A lot of changes in the 27 years. And then just in the last 5 years, I went from a supervisor position of 10 years to a manager. I've been a manager for the last 5 years. I grew up in Central Oregon, lived here in the Willamette Valley since I was 18. And my extended family is over here. I had to add my cat, Mick Dundee, because he, in this pandemic, was the consistent thing I had to help me through the pandemic. Since I don't have anybody, I'm alone in my house. And so it was kind of looking back this last year, how much that his presence actually meant a lot to me. And I think as we think about the pandemic and mental health, having those connections, whether it's with a cat or, with other people, is really important, especially in times like this. And you all will meet Mick down the road too, as we kind of talk about pandemic and kind of how people are feeling during the pandemic. And of course, I have to give a shout out. If anybody's been to the Shakespeare Festival, it's a wonderful experience. I just love that area down there. I highly recommend it if you haven't. So Lynn County, I stress this quite a lot with new employees and with staff here because it's so important to see us as different than other mental health clinics, especially on the private side. Lynn County Mental Health is a community mental health program. So we have to think about our community, not just the person coming in to see us getting services, but how that person relates to the community and the people around them, helping them as well. And so most of our services are community-based. We have therapists in the schools. We do outreach to homes. We see people in the hospitals, emergency rooms. We go with law enforcement to do kind of crisis mobile. We're in the jails. We work with DHS, and we're with DHS in their office. So all of our focus really is our community and our community partners, shelters as well. We do a lot of work with shelters. Within Lynn County Mental Health, we have, again, doing a general overview, we have kind of 4 areas that we focus services in. One is crisis. So we do crisis mobile, we do investigations like commitment investigations. We go to the emergency rooms and hospitals and do assessments. And a lot of outreach with crisis as well in the community. And we have adult programs. We have actually 2 main adult programs. One is community support services, which Mary Dale supervised for many years, and adult outpatient services. And community support services, for the difference between those two is community support services is working with people that have severe mental illness that's like psychotic symptoms, so schizophrenia, bipolar psychosis. So they have high level mental health issues. The adult outpatient is more moderate level, so it's non-psychosis, so trauma, anxiety, depression, and that's one of our only, that and our medical program that really don't do outreach. The adult outpatient is more therapy in office therapy. Obviously, community support services, they're out in the field, they're out in people's homes, checking in on people because their role is to try to help people be successful in the community. So managing their illness, taking medications, negotiating around the community, like Social Security and primary care and things like that. Then we have child services. So we have school-based where therapists are in the school. We have pretty much a therapist attached to each school in Lynn County. Now, they may only be, like when I say be there, pre-pandemic, be there like a half a day or a day, depending on the need. but pretty much we have a therapist attached to the school. And then we have intensive child services for kids that are kind of at that higher level, maybe DHS, Department of Human Services involvement, legal involvement, not doing well in school, having behavioral health issues in school that are leading to not being able to be in school. So higher need kids that potentially are looking at higher levels of care as well. And then, of course, we have the medical, which includes psychiatry and nursing. We have a good relationship with the Lebanon School medical school, and we have residents as well. So it's kind of nice that we have a fairly good psychiatric program. And as Marydale knows, we have a wonderful new medical director too that's really has a really fresh lens on how to do things differently with psychiatry, community mental health psychiatry, and within the community, and working with primary care and others. So that's a quick overview of Lynn County Mental Health. So Lynn County Mental Health during a pandemic. So about a year ago, actually, little less than a year ago, the pandemic started, and we had to really focus on adjusting our services. And so as with you guys trying to adjust your organization to Zoom and telehealth, or to virtual, we had to too. So we scrambled and got Zoom accounts, and were able to kind of switch over to telehealth and phone services. And what's nice about that is Medicaid and Medicare during the pandemic allowed for that type of service to happen, because typically to bill for certain services, you had to be face-to-face in person. And so they switched up their requirements to allow us to use telehealth and phone. So we had to scramble to get licenses, to get people's laptops with cameras, things like that, so that we can provide that service. We wanted to limit, obviously, exposure for in-person services and kind of reducing our traffic in buildings. So we really pushed the telehealth unless certain criteria, like if there was a need to do some sort of face-to-face, and sometimes there was a need to do face-to-face. And then we looked at developing plexiglass rooms with plexiglass and telehealth rooms where people can, well, telehealth is still telehealth, but we tried to switch things up so we have options, but safer options to see people. Our primary in-person services, though, were really just crisis and community support services. So, helping people in the community. But again, we tried to focus on being outside more and trying not to drive people, together in a car, being around them in close proximity. The one thing that I say no in school services, obviously school, shut the doors and did their own teleschool where they're doing the school virtually. So we didn't have therapists going into the schools and getting referrals from the schools that way. So that was a big shift for us as well. And we were kind of chatting earlier about kind of the pros and cons to doing virtual and kind of having these options. And I can say that we have been seeing some positives. One is that there's flexibility with phone in Zoom to provide these services, so that people are are being like a therapist being in the Albany office can provide therapy in Sweet Home or Lebanon. And so there's some flexibility around being able to see people wherever they're at. Whereas before we would have to have like a Sweet Home therapist and they're seeing Sweet Home clients, and it was more location. Whereas the telehealth we were able to kind of have more flexibility of how we used our staff to meet the needs in our community. And obviously there's, no transportation. So clients were easily able to get into their appointment because they didn't have to worry about somehow getting there, getting gas, getting a ride line, which is a Medicaid medical transport to get them to our appointments. The crisis actually too, there was a quicker response. So crisis was able to set up with the emergency rooms to be able to do telehealth assessments with some people. And they kind of had to pick and choose which ones they had to actually go in to see versus doing it from the telehealth, the computer. But it was easy. It provided them a quick response to that need at the emergency room. And if you think about a pandemic, you don't want people hanging out in an emergency room, potentially being exposed or potentially taking up a bed that might be needed for somebody else. So being able to address mental health issues in the emergency room sooner than later. Before telehealth, a crisis worker might take an hour. Let's say they live in Lebanon and the call is into Corvallis, because we go to Corvallis ER, Albany ER, and Lebanon ER. So it might take them like an hour to get to the emergency room. And again, with telehealth, it's 5 minutes, right? You're right there, and you can support the emergency room. You can support the client and reduce the length of stay in the emergency room. And the last pro, which is meetings, that's kind of mine because I'm in a lot of meetings. And before telehealth and before using Zoom for meetings, I would be driving to Corvallis, 3-4 times a week, and to Lebanon. And that's time on the road where I wasn't able to manage things here at the office and with the administrative tasks that help this place keep running. So it really helped with that too, being able to have more time to do things.
So, Tanya, I have a question. How many have there been any staff that have been positive for COVID, or clients and how many?
We're not tracking numbers. Part of that is because it's also, health, protected health information too.
Right.
However, I do know we've had a few staff test positive. And thank goodness it was in a situation where there wasn't exposure. I mean, we've done a really good job here. About trying to, we're always wearing masks. If your mask is off, your door's shut, you're not meeting with people. If you're meeting with people, it's, 6 feet apart or more. So we're doing our best to try to reduce, if there is somebody here in the building, that we're trying to reduce that exposure. And I don't know, I'm sure there's been clients, but I don't know of any personally that I've heard of that have tested positive for COVID, but I'm sure there is.
Yeah.
I just haven't heard that. But yeah, I think we've done, a pretty good job about trying to reduce, if somebody is positive, the overall effect of how that works with us for exposure. I do worry about the supposed variants that are coming out that are a little bit more contagious. So, but most of us have also had the opportunity as healthcare providers to be vaccinated too. And roughly, and this is not just mental health, but from what I'm hearing from Lynn County, it's still kind of one of those iffy things if people want to get vaccinated or not. And so we're roughly, I think, hitting subjectively around 50% wanting vaccines and 50% either wanting to wait a little bit longer for the vaccine to feel comfortable or not wanting it. And that's subjective from what we're seeing. So some of the cons there about adjusting things for the pandemic is one of the things is that for mental health, we really rely on seeing people face to face, their body, the body language, the up close face expressions as part of our assessment and as part of our rapport and engagement. So that's harder during doing stuff virtually. And so we struggle with that. The other thing is I had conversations with the school and the teachers who, interestingly enough, also struggle with that, because they want to know how their students are doing and how engaged they are. And if they are having mental health issues, and they've relied a lot as well on, seeing students in the classroom and their body language and their facial expressions to see if they're learning or if they're having mental health issues. We've also, the downside is not having privacy at times. So we've known clients that we're working with that might have roommates and they don't have a private space to do telehealth or phone calls. And so it's because their roommates are there and they just can't find a private space. Or we've also had clients who are driving and doing a therapy session or shopping and doing a therapy session over the phone. So we've had kind of these little interesting things that pop up that's like, ooh, yeah, how do we, because it's so accessible as people are walking around and doing their own day-to-day stuff, to stop and do a therapy session and have a private area have been difficulties for us. Obviously, access too has been difficult. Access to phone and computers and internet service, things like that. And of course, as I said, school-based services suffered the most. So, in my opinion, and I'll show you data here next regarding that. But now, the nice thing is when this all happened, we met with the schools, and schools gave out Chromebooks to students. So to do their virtual education classes, and they were very much allowing them to do telehealth with us. So that was really good that we were able to connect and use that resource for kids. And the other thing is the groups that we had were kind of dropped because trying to reduce that in-person, multiple people in one room. We've tried to look at groups, virtual groups, but again, because of like roommates and people not realizing that they need to like make time for this, and they're out shopping while they're doing their therapy session, and potentially people coming into a group session that's not supposed to be there, like a child or a roommate, has made people be hesitant to do Zoom groups because we want people on the group to feel secure that there's nobody else that's going to be around hearing that stuff and hearing what they're talking about. We are looking at some therapy groups and have done some in larger spaces, bigger spaces where we can spread out and have that physical distancing. And of course, all the protocols, taking temperatures, wearing masks. So there are a few kind of higher need groups that we are doing in person. One of the things I wanted to share with you guys, which I think is quite interesting, is the data comparison. pre-pandemic versus during the pandemic, because I was really interested because we knew that our kids services decreased quite a bit. So I wanted to have data that talked about that or showed that. And what I did was I took 2 different quarters. So I took quarter 2 data for 2019 and 2020, which is April, May, and June. And I wanted to look at just our general enrollments, people that we open for services, and then also our crisis services. And looked at children, transitional age youth, which is TAY, and adults. And you can see that in 2019 for kids, we saw 264 kids during those 3 months. In 2020, we saw 167. So we had a pretty drastic drop there. But really no drop in transitional age youth, and really not that much of a drop in adults. In crisis, in 2019, we saw 57 crisis assessments for kids for that April, May, June time period. In 2020, we dropped almost more than half in crisis. And then you see the same in adults with here. Transitional age youth stay about the same, but adults really decreased too. And if you think about the time period we're talking about, that was kind of the beginning of the shutdown, the pandemic and things shutting down. And because I worked with crisis as a supervisor for 8 years and on call for 10 years. And what I do know about crisis is when there is something big going on, people tend to kind of manage their own stuff in order to kind of survive whatever that situation outside of them is happening. So a good example is a big snowstorm. We don't see crisis happening during big snowstorms or big weather events. People don't get into crisis. Pandemic, I think, is the same thing. We look here, and there was really a decrease in crisis, I think, because people were dealing with the beginning of the pandemic and what that crisis, what that meant for them. And they kind of hunkered down. They were able to manage their own internal stuff that was happening in order to address the external crisis at hand. So that was spring, April, May, June. And then I looked at October, November, December. So quarter 4, 2019 and 2020. And you can see that, we're into the pandemic, the crisis is over. So our adults crisis assessments kind of get back to being about the same between 2019 and 2020. However, our kids services remain about half-ish of what they were. So, we aren't seeing the kids as much as we were before the pandemic. And so that's been consistent. We have not been able to see the kids as much as we were and have been. And to the point, and this is where the some of the flexibility is that I had to shift some of our child outpatient staff to doing adult work so that we can, attend to, because they had time because they weren't seeing the kids. And I have to say, we tried to do everything we could to get out there and outreach to kids in schools. So what we did was early on, we were trying to be there for schools, trying to see how we can. I got a hand up.
Hi. Yeah. I just wanted to ask you about the data that you have on kids. I'm seeing that the numbers decreasing, but I'm wondering about those numbers though, because I work with early intervention, so that birth through age 5, and I do see families and kids in crisis. However, families feeling so overwhelmed that sometimes services for their kids kind of lag behind.
Mm-hmm. That's a good point too. I kind of I don't know if it was, I think it was this slide. I was kind of trying to figure that out too. Is it so because our kids' services dropped pretty much almost like 40-50%, what was the reasoning behind that? And of course, we may still be trying to figure this out a year from now. But your point being is the family so overwhelmed that maybe that resource is not accessed because they're dealing with all this other stuff like unemployment or due to the pandemic or trying to figure out how to support their kids
right. And what I'm finding too is that for like preschool age and younger kids, families have decided that they're going to focus more on their school-aged kids because their schools are demanding so much. And also there's the belief that families just think that their kids are not going to like sit during a teletherapy type session too. So there's also that belief as well.
I think there was a few of them that also, I agree with that too, is that there was a few that said, no, I'll wait till there's in person. And it was kind of this one here, the kids' mental health issues not being recognized versus school triggering mental health issues. And I think the issues that you're bringing up, Denise, are very important. Is why the decrease of referrals and is it family based, like the family dynamics of increased other stressors that they're too overwhelmed with maybe to do treatment, or or putting more of a emphasis on school, or not wanting to do virtual. I also wonder, because I think a lot of our referrals through schools come through the schools. So if they're not in school, are they not being recognized? The mental health issues not being recognized. And then another question I have is school triggering mental health issues? So do we have kids that are maybe because of bullying or maybe because of having to, schools have different rules and different ways of operating. And you take a kid who doesn't really, that they don't have that experience, or that experience is triggering, those rules and the way they operate is triggering anxiety or other types of mental health issues or behaviors. So it's really a lot of questions about the reduction of kids services, concerns too. And, we tried our hardest to outreach to schools and DHS, ESD, trying to send them information to send out to people and parents. We had meetings with superintendents. I told my providers too that I said, do anything extra to do outreach, to engage, people, the kids. One of the things that we do have what we call soft codes, and if they're not billables, but they're kind of, they show the engagement. It's to track engagement, like outreach and calling and trying to get people in and working with people that are have been referred. And our soft codes did go up during this time. And I think it's because people really were trying to make that extra effort to reach out. And I also know our providers were thinking outside the box to provide these services and how they provide them. I do know that we did do some in person, like in the parks, and bigger rooms, things like that, especially higher need kids. Some of the therapists really got into Zoom and using Zoom in a very creative, fun way for kids. With Zoom has all this funky stuff that you can like add like ears to your face and all that stuff. So, which was kind of fun for kids, and games. What I do know is that school services are starting, and so we are trying to prep and make sure we have providers that can, because my thought is once the kids go back to school, we'll have an influx of referrals. So again, we'll see that probably in the next couple months. But that's what we're gearing up to is for a influx of referrals. So trying to make sure that we get people in quickly, kids in quickly. Here's Mick.
Oh.
So I'm using Mick because Grant, I told you guys earlier that he was my the thing that kept me going day in and day out. But I would catch these little some pictures of him, and like this one to me reminds me. This was kind of at the beginning actually of the pandemic when I took this picture, and he's looking out. And that's kind of how I felt. I was like looking out, very apprehensive and sad. I was, what do I do? Do I go to the store? Which store should I go to? How do I navigate this pandemic? So, just that uneasiness, that uncertainty, that fear. If I go to the store, will I be infected? If am I going to get infected at work? What is this going to look like? And granted, back then we didn't have as many answers as we do now, which is helpful, but still a lot of apprehension and sadness around that I was experiencing. I was also annoyed. So I had a lot of moments where I felt annoyed, as Mick is showing on his face right now, as he's kind of annoyed. I was annoyed at not, having to wear a mask, and my skin's changing because of it, and having to navigate all these different, oh my goodness, we had to navigate OSHA and all these, OHA and CDC and trying to it was just annoying to have to go through all that. So I had a lot of kind of those feelings at times. I was also angry. Even though, this shows Mick's beautiful things, he's actually yawning during this, but he shows his fangs that he's, angry. But, angry. And not only did we have to deal with the pandemic this year, but we had to deal with the wildfire. We had to deal with political strife and division and stressors with that. And so, some of the feelings I had was a lot of anger that people weren't listening, anger that we were having to go through this, scared, fear, sadness, loneliness. So just all those feelings were coming up. And one of the things that I had to keep reminding myself is, how to be content, and this is a picture that I think Mick looks quite content, quite at ease. And how do you, a person should not, in a situation like this, you're not striving for happiness. You're striving on just being okay. That's the goal, is just to be okay. And so, it took some effort to look at those time periods and situations that I can kind of grasp onto and say, hey, I'm okay. I'm content. I'm doing okay. I have a lot to be thankful for, which helps with being okay and content. So there, I use my cat to help kind of talk about kind of what people are experiencing during this time. And that's just a smidge of what we're experiencing, but I think kind of has, I think all of us can kind of appreciate that we've all probably had those thoughts and those feelings at some point during the pandemic. So when we talk kind of about mental health, and especially during the pandemic, it really is trying to weed out some of those unknowns and those fears and trying to kind of stay present. So staying connected. One of the things that I haven't liked about the media and the pandemic is the word social distancing. I struggle with it because I sometimes say social distancing. We should be saying physical distancing, because that's what it is. The idea is to try to stay, 6 feet apart, reduce our physical connection, but it shouldn't mean that we're not socializing or having or distancing socially. We can still social and we should connect and socialize. It just may look different than it did before. The other thing that was important is routine, sleep, move, routine, something that's always a routine for you to keep in. Having, good routine of sleep, good routine of movement. I say movement, exercise, getting out, fresh air, that sort of thing. Meals, eating, making sure you're kind of in a routine with that. One of the best things I did, and I was able to do, is I got a bike, a Peloton bike, and that really, really helped me. I got it this summer, and it's been very helpful. Compassion to self and others. It's like I said, it's been a hard year. So how, to not be hard on yourself. And one of the things I was talking to Tim earlier is I think the media did a really good job with some of their commercials about we're all in this together, and putting out some of those feelings that kind of like I had with my cat, and saying, hey, yeah, we're all experiencing, we're all sad, we're all afraid. We're experiencing this because we're in this together, and that's somewhat normal during this time period. I've also appreciated how they tried to connect people to phone numbers and resources as well, and reminding that people are doing the best that they can through this time period, and being compassionate about that. And I talked about validation actually, and focusing on something positive. So, as I said, my focus was Mick because he's like consistent. I knew he'd be there when I got home from work, and I knew he'd be there, when I was watching Netflix. And I also did a lot of distraction. I read a lot of books. I do escape in books. And so I made sure that I was reading books and trying to take my mind off of what was happening. The other thing too is I think breaks from the media is important. The media, and I'm not saying media is bad at all. I'm just saying it's intense, especially in a year that we just had. There's a lot of intensity, and taking a step back or reducing it, I think it can be helpful. Here's some resources. We have a kind of a COVID tips and wellness. There's a video and some tips on our website. The Oregon Department of Education has some really good resources on mental health and well-being for kids. Lines of Life also has some really good resources there, and mental health first aid, self tips for healthcare workers. So I wanted to end so that people had the ability to go and do their own research for what is needed for themselves or for other people that they're working with. And that is it. Is there any questions or comments or thoughts?
I have a couple of questions.
Great.
The first one is, I understand that your resources for treating children during the pandemic are somewhat limited, but I'm wondering what kind of outpatient counseling you provide other than in the home set or in the school setting for children and teens.
Yeah. Well, we're based in the schools because that's where a lot of the kids are, but we definitely do therapy in office as well. And if it need be, there's been times that we go out to the homes too.
And does that include family counseling as well?
If it's clinically indicated, it can be family as well. And typically with kids, you are working with the family system, the parents or the guardians or whoever's working with the kid too, because the kid can't change unless the family systems support that, right?
Right.
So usually there is work with that. We also do. We also have a skills trainer that does some skills training with kids, and we have child psychiatry too.
Okay.
Yeah.
And then my other question was, during this time when people are trying to access the telehealth services, how do you deal with people in the nursing homes or assisted living who maybe don't have access to a computer or don't have the skills to use a computer? And I would think, because so many of them have been quarantined for so long, that could be a real issue for them.
Yeah, no, definitely. And I know that some of the residential homes and care homes have access to telehealth and provide that. We also have an older adult behavioral health initiative that has provided some. They're not really providers, but they've been able to. They work with residential homes and senior services to try to provide education and groups and things like that in the home for seniors. And they've done some Zoom work groups doing that, mostly educational, like how to deal with isolation, how to manage depression, things like that. So there has been, I have to say that there's probably not as much as robust as it could be for older adults, but I do know that they do have some telehealth options in those places, and that the older adult behavioral health initiative workers have done outreach there to provide some educational groups and supports, as well as this with the senior center too.
Thank you.
Yeah,
It
is a concern.
A question as well, and this is around access. So I'm wondering if all kids and families are able to access services, or if it's insurance dependent. And also, I'm wondering what data you have around race and how, particularly in terms of COVID, how it impacts like different ethnic and cultural groups.
Yeah, good questions. Very good questions. I don't know if I'll be able to answer them fully, not being prepared. But your first question was, I lost it. I apologize. Your first question was access, right? And who can access. So being community mental health, we are primarily Oregon Health Plan or below 200% poverty. Now, we do see other people above 200% poverty or private insurance if they meet priority 1, which is high suicidality or high mental health issues. At the very least, we do that to bridge until they're well enough to get into a private provider. I have to say, mental health resources are very, very slim, even in the private sector. So it's kind of we are paid by Medicaid, and so that a lot of our money comes from Medicaid. So we're kind of mandated to serve that population below 200% poverty. And depending on our capacity, we can adjust to more, but we have to kind of look at our capacity as well. So that's why we tend to try to connect people that are above 200% poverty or have private insurance to outside providers. And we'll do that, and we do screenings because if, like I said, if they are high priority, we're not gonna leave somebody that's highly suicidal to wait 3 months for a therapist in the private sector. So we're going to try to do something to help that person. As far as ethnicity and race, one of the things that I did connect, and we're trying to, mostly in the Gap School District, just because of having the people available to do this. But I have a provider, a therapist, who's connected to try to build on bridging some of the race and ethnic issues into mental health. One of the things that Lynn County hasn't done well in the past is kind of promote ourselves and advertise and make sure people understand what we can do, and especially with people of color. And the idea is having that provider trying to build that bridge with our school district. So we're working on that. We did do some, like as an example, we did a testing fair. I don't know if it's the right word to call it, clinic, I guess, for people, Hispanic individuals. And so I sent mental health providers there and to do some outreach with that population. I do know with our vaccines, we have the Todd Noble, the director, bought a van to do more outreach with rural areas and different ethnic groups, so that we can, as soon as their time comes to be vaccinated, that we can maybe try to do more outreach instead of them coming into the fairgrounds to be vaccinated. I have to say that Lynn County has a lot, and Lynn County Health Department has a lot to grow in this area. And I say that because I started a diversity committee just a year and a half ago, something that we as a county have never done. And it's kind of, I have to say, and I'm being transparent, but it's something that we should have done a long time ago and should have started really kind of building more of those connections. We definitely try to, we have providers that speak Spanish. We do want to make this a welcoming space and bridge mental health to those populations, but we just still have work to do, and we're trying to do it. So hopefully I answered your question. Okay. Any other questions or comments?
Hi. I'm wondering if Lynn County is seeing an increase in violence as you see a decrease in people accessing services.
I don't know if I have that information.
Right.
But one of the things that I do know that I didn't get into details about is that our because of the pandemic, our state hospital is closed to patients. So we have typically a person that has high mental health issues and is entering into the emergency room. And if they need to, they'll go to an acute care hospital, a psychiatric hospital. And then if they need more services for longer time, they'll go to the state hospital. Typically they're committed or they have a guardian to have to go to the state hospital. And so if you think about the state hospital being our highest level of care for clients at their highest mental health, with high mental health issues, and that being closed, that poses a problem to the community. And unfortunately, we've been seeing some of this prior to the pandemic just because of bed availability and resources, but seeing more people on the street, homeless, that have high mental health issues and high addiction issues that are out there, struggling. it's definitely a concern, and I think we're going to see it more because right now the bed issue at the hospital during the pandemic has really reduced.
I'm just even wondering, not necessarily even with violence within the mentally ill population, but just I actually live in Portland, and gun violence is exponential, and there's no obvious, no one's explaining the reason.
Yeah, no, I've noticed that too.
Yeah. And I just didn't know if it was as true in Lynn County as it is here.
I saw something on TV last night, Kathy, where that they are attributing the violence to increase of gang violence.
Right.
And
but what's triggering that? I mean, what's behind, and
yeah,
and if obviously if you can't reach kids, then they're on their own more. I just think there's going to be a lot of chickens coming home to roost, I think, is.
Well, I think that's what they're
wondering.
saying, that this pandemic, the mental health and addiction issues are just beginning because of the pandemic. So as the pandemic hopefully starts to wind down, they're thinking that this effect on our society as a whole is going to be years down the road. Because of like the unemployment, because of the housing issues, all that, and the inequities. I mean, if anything that this pandemic has shown is the inequities of our health system. I find it horrifying. I have to say this gets in because this is where I get upset, right? As I was talking about with my cat pictures, but I find it horrifying that when they post the pictures of people that have died, how much people of color are in that. I mean, it just is so upsetting to see that, and the health inequities that have really just exploded. I mean, they've always been there, obviously, but they're so noticeable now. My hope is that if anything, that this pandemic does help us really, really try to figure this out and do things different and better for those inequities. So
I'm aware of time. It's 10 after 6, and a number of people here also have to go to a board meeting in 20 minutes. So I just want to thank you, Tanya. Does anybody else have any final thoughts or questions that you'd like to in the clapping?
Well, I hope I kind of at least gave a fairly okay overview and met some of your guys' needs. I will send my slideshow to Tim, I guess, and because I know there's those resources on there. It might be easier for you to get those resources, those links to look at. There's actually quite a bit. I think there's a lot of resources out there people can access.
Can you also send us information on that diversity group you mentioned?
That's that's our department group. Is that what you're talking about?
Yeah.
It's pretty new and it's just a department, but I can send you our charter.
Okay.
Is that okay? Yeah, I can definitely do that. And if you have any questions or interests, because like I said, we are early in the process. Like I said, about a year and a half. We're trying to get a climate survey out. We did an assessment. Yes. So, but I will definitely send the charter out. Okay. I appreciate this time. I always think it's important for to have this community time as well, because I know you all do really good work, not just with the congregation and the members, but in the community itself.
Thank you. Well, and I'm sorry we had our Zoom problem and some folks didn't make it in to be with you. Yeah. But it clearly shows me that there was a lot of interest, and thank you very much, Tanya.
Thank you very much.
Yeah, anytime. Thank you for having me.
Thank you.
Thank
All right.
you.
Thank you so much.
All right, bye-bye.
Bye-bye.
Bye.